Hello, everyone. I welcome you all to yet another episode of discussing common mental health condition. So today I will be discussing briefly on neurodevelopmental disorders. So, neurodevelopmental disorder is like a family. It's not just one particular condition. It is made up of different conditions that affect the brain and the nervous system development. As we know, the brain and the nervous system controls virtually everything we do. For us to be able to think, the brain must send signal. For us to be able to walk, the brain has to send signal. For us to identify danger and move away from this danger, the brain has to send a signal. Now, what happens if the brain is not fully developed? That's what we'll be discussing today. If the brain is not fully developed, like if the brain and the nervous system is not fully developed, the individual suffers from what is called neurodevelopmental disorder, and this affects how the person thinks, how the persons behave, how the person is able to move their hand or their legs, and also how the person is able to function socially. By social functioning, I mean interaction with other people. Now, what are the common types of neurodevelopmental disorder? We're familiar with some of them, which includes the ADHD, which is the attention deficit and hyperactive disorder. We have the autism spectrum disorder. We have communication disorders. We have developmental coordination disorders and intellectual disability. How do we identify people who are suffering from a form of neurodevelopmental disorder? Let's take autism for instance. A child who is suffering from autism spectrum disorder usually have problem with communication and social interaction. The person kind of the person is usually limited with a repetitive behavior. The person likes a routine and there is usually a kind of restrictive interest. Like if the person is interested in A, you can't force the person to start being interested in B. That's the major characteristics of someone suffering from the spectrum. Like their social interaction, social communication is usually limited and minimal. And then there is this repetitive behavior. They have a pattern how they do their thing. If they usually wake up at 7, and after waking up, they get up straight, brush their teeth, put on their clothes, have their breakfast. You can't change that routine. And that is why when they leave the environment they are used to and maybe go to a boarding school, maybe for some parents who don't know that their child is suffering from autism, and they change their environment, and then the new place where they are try to change their routine, they tend to manifest by being aggressive, by throwing tantrums, and by displaying some form of maladaptive behavior. And if you don't understand that this individual is suffering from the spectrum, you may start thinking, oh, this person is stubborn, this person don't want to follow the rules, this person don't want to comply with simple instruction, and then there will be kind of punishment which the person usually actually does. Another form of neurodevelopmental disorder, another type of neurodevelopmental disorder is the attention deficit and hyperactive disorder. So this type of disorder is characterized mainly by poor concentration, inattention, hyperactivity, and impulsiveness. The person is usually hyper. The person can't even sit in a place. The person can't concentrate in finishing a particular task. You tell the person, do this, and the person just does it halfway and move to another. They usually don't complete their tasks. They act on impulse, and they kind of they don't usually pay attention. You will be talking to a child with ADHD and the child is looking somewhere else. The child may even leave you in the middle of discussion and go to do something else. I'm using a child to describe this because usually neurodevelopmental disorders starts from childhood. And if not identified and managed early, I say managed because the condition 99.99% of the kids is usually not treated. So instead, they are usually managed. If the child is not managed early, they grow up into a more complex condition. So for ADHD, the child is hyperactive, the child lacks attention, the child usually does not compose complete tasks, and the child usually acts on impulse. While for autism, the child has a particular way of doing their things. They follow routine. They usually find it difficult changing from one routine to the other, and then there's problem with their social communication. Some people could say that people that are sanguine, people that grew up to become, to have, people that grow up to have this social characteristic that are sanguineous are usually people who escaped being diagnosed ADHD during their childhood. Another form of neurodevelopmental disorder is communication disorders. And this usually has to do with people who cannot communicate well, people who find it difficult producing speech or sound, or are finding it difficult understanding simple spoken word, or to even um, understand written word or languages. Let me take it again. For communication disorder, this type of people find it difficult producing speech sound. They find it difficult talking, they find it difficult understanding or using spoken words. Example of classification under communication disorder, you could have something like stammering or stuttering. Yes, it is one group under communication disorder. Communication disorder is different from specific learning disorders, which is SLD. Yeah, SLD, specific learning disorder, is another form of neurodevelopmental disorders. So people who suffer from a specific learning disorder can have problems like dyslexia, that's they are not able to read, dysgraphia, they are not able to write, dyscalculia, they're not able to solve simple mathematics. Now, let's not get it twisted. For a diagnosis to be made, you must compare the age of the child and what is achievable for that child. You don't expect a child who is 2 years old to start reading full sentence. And if the child is not able to read the sentence, you now say, oh, maybe this child is having some form of specific learning disability. No, no, no. You must have to do your full assessment, comparing the milestone of this child and what they are able to achieve at that particular stage. Another form of neurodevelopmental disorder is the developmental coordination disorder. Remember when I was introducing this topic, I said the brain controls every activities of our body, the brain and the nervous system. It controls how we walk, it controls how we talk, it controls how we respond to situation. Now, when there's developmental coordination disorder, DCD, the individual is not able to really use their motor skills. Motor skills is our ability to move, like our ability to move from one point to the other is what we refer to as motor skills. So when this individual is having problem implementing motor skills, like they have problem walking, they have problem using their fingers to complete, using their hands, sorry, to complete simple tasks. It has to be a kind of pointer to further check to find out if this individual is suffering from a form of neurodevelopmental disorder. Another class of neurodevelopmental disorder is the intellectual disability. That's your It usually presents as inability of the person to learn, to uh, solve simple problem, and to adapt to life skills. You know, there are some people that usually are slow to learning. There are people that in a class, you teach some people, oh, you just describe what a noun is, and some children are able to grasp it faster, while other children you may have to continually repeat and repeat and repeat. And some of those children or some of those people, no matter how long you try to repeat it, they usually don't get it into their head. Now, that may not be a problem. It may be an intellectual disability, right? Then you try to move this individual into learning skills, and the individual is still not able to learn the skill you put them into acquiring. You don't just cast the child away. There is a place the child can fit in. First, you need to get good help. You need to get appropriate help for this child. Take the child to see a psychiatrist. They will run series of psychological testing on this child so that a proper diagnosis can be made and a good help can be achieved. Now we ask, what are the major causes or what are the causes of neurodevelopmental disorders? Like I stated during the introduction, neurodevelopmental disorders starts from childhood. And of course, most things that starts from childhood or are identified during childhood could be things that are present at birth. Now, the three factors are implicated in the cause of neurodevelopmental disorder. One is the genetic factor, which in most cases we do not have control over that because they are usually natural causes. We don't have control over the type of gene that comes into our body. It could, and once this gene is gotten from one parent, the tendency to keep passing down to generation and the next generation and the next generation is there. Another factor we can be talking about is environmental factor. Now, some form of pollution in the air is likely to cause neurodevelopmental disorder. Yes. Another factor could be exposure to some stress, severe stress, especially during pregnancy. You see, in most cases, when healthcare workers advocate for safe pregnancy and safe deliveries, a lot of us, especially in our culture, don't seem to understand. We still think, oh, why shouldn't this woman do this? Why are you being so petty because you're pregnant? You hear people say things like, oh, are you even carrying Jesus Christ? You hear people say things like, yeah, Mrs. A carried her pregnancy. There was nobody with her and she didn't disturb anybody. Why are you being so disturbing? No, no two pregnancy is the same. Women of childbearing age needs all the support they can get when they are pregnant, because if this woman is exposed to so much stress during pregnancy, the tendency that the fetus in her uterus will be affected. Yes, some people can be strong. They can go through the stress and still give birth to normal, healthy baby. While some people, a little form of stress will definitely affect her and affect the baby in utero. Women also are advised to not smoke when they are pregnant. They are advised not to take excessive alcohol when they are pregnant, as all these things impact on the child's brain. Now, also birth trauma. If during the process of pregnancy, it's possible that when a woman is pregnant, the doctor, the nurse, or the midwife could assess them and say, oh, yeah, your pelvis is okay. You can deliver your baby spontaneously through the vagina. But if during labor something happens and the health workers suggest that we're sorry, we cannot continue with spontaneous vaginal delivery, we need to take your wife to the theater. Don't see the woman as a weakling. Don't see having a cesarean section as an abnormal form of delivery. Cesarean section, forceps delivery are all assisted method of delivering a baby. So instead of making a child suffer or making the woman suffer during the process of childbirth, it is better a cesarean section or an assisted delivery is carried out so that the child can have a better neural development. Now, the next question is, can these conditions be treated? The answer is there is no cure for neurodevelopmental disorders. However, with early diagnosis and early treatment plan, the child can live as near normal life as possible. And these treatment plans usually includes cognitive behavioral therapy, where the child is taught in a slow pace how to act, how to behave, how to talk, and how to interact. Then getting the proper school for this child is also important. You don't carry a child who has learning disability to put and start rushing this child in his or her academic. I don't know if you understand what I mean. There are usually special schools for children with such neurodevelopmental disorder. It is important that parents look through and ensure that the child attends the school that is best for them to help in their development. So in general, we just talked about neurodevelopmental disorders, the different classes of neurodevelopmental disorders, what could cause neurodevelopmental disorders, and of course, the possible management of children with neurodevelopmental disorder. You can drop your questions in the comment section and I will try as much as possible to answer them. Thank you very much, and I'll see you in my next video.